This is QD Clinic. I'm Dr. Jack Cush from Room Now. QD Clinic is brought to you by RoomNow.live. The meeting occurs in 2 days. You can choose. You can choose to be in the room in Fort Worth, join 100 plus of your colleagues, or you can choose to watch from home on Friday, Saturday, and or Sunday in the comfort of your fuzzy slippers. Go to RoomNow.live, register, choose which one you want to attend. It's going to be a fabulous meeting. You're going to really enjoy it. And if you're home, you can be connected in the same way people who are in the room are connected. You'll be watching the same lectures. You'll have the same downloads. You can vote on the same questions. You can ask questions from the comfort of your desk and or living room. We'll see you on Friday, Saturday, and Sunday at Room Now Live. This case is called Chat 'em Up. Last week I saw a patient, and as I was starting the visit and going through medicines and some tests and things that were done, just reviewing some data, I just had an offhand conversation with the patient about a movie. And what ensued was a delightful 15-minute discussion on things that made her happy. And I got to listen to that and make some suggestions that furthered our relationship and discussion, and honestly made the rest of the visit a whole lot easier. So my point is, I think at some point with most patients, you need to spend time talking about something other than their medicines and their hack score and side effects and insurance problems and what hurts and what's not working right, and one of 95 different medical problems. I know there's a lot to do, and chit chat might not be your game, but you know, chit chat is really how the rest of the world lives and communicates and learns to trust each other. So to spend some time, a little bit of time, learning what movies they like, what hobbies they have, what's their project that they're working on, where they travel to. You know, my patients love for me to tell them about where I just came from and what that was like. And they think it may be glamorous or exciting, or often they tell me about places I should go to when I'm in Italy or wherever it is I might be going. And those are good things to know. I find it really interesting when I can start a conversation with a patient that begins with the following words. You know, because of you, and I tell them a story. Or, you know, last visit, you taught me a really important lesson. Or, I've been thinking about you. I'm really glad you're here today because I want to talk to you about. All those statements are about you, the patient. And it tells the patient, I'm thinking about them. I've got something to say with them that is going to be pleasing or interesting or important to them. They always like to talk about their family. They want to talk about medical things going on in other members of their family. You know, patients who have chronic illnesses and see you regularly may be the smartest medical person in that whole family. And they go to that person asking for advice. And when you can impart some advice on your patient that lets them take care of their husband or their child or their mother, boy, they really appreciate that. You further the relationship between the two of you. Again, with them, what's in it for me, it should be what's in it for them. And discussion and conversation is big. I think when you engage in this, they can appreciate you and you can appreciate them, and it really furthers what it is that you have in a long-term relationship, which is at the core of best medical care. We'll see you at Room Now Live.